We're joined by Dr. Don Catlin, live from Los Angeles. He's the founder of the UCLA Olympic Analytical Laboratory. Thanks so much for joining us.
Thank you for having me.
So far, we've got a Cypriot weightlifter and an unnamed Greek competitor that have tested positive for banned substances, and they've been expelled from the Rio Olympics. Olympic drug testing is thought of as the gold standard. Why is that?
Well, that's because the Olympics is sort of a gold standard of sport. There are many different sports involved, as many as you can think of, and the IOC wants everybody to be perfectly clean. So they build a lab in the town or city where the games are going to be. And that lab is there just to do the testing of Olympic athletes. So in Rio, you have a brand new lab dedicated to the Olympics and Olympic testing.
Every other Olympic Games has these on-site labs, though. But how has the drug testing changed since the previous Summer Games in 2008 and 2012? What advances have been made technologically?
There are changes almost every day. There are several different basic mechanisms that are used. GCMS, LCMS. These are very complicated techniques, and a small change in the steps leading up to the analytical phase can make a big difference in detectability of a drug. So a drug that was easily found, say, a year ago, now with new technology can be found for much longer. And that's a constant process. There's about 80 different drugs, and the technology is changing every day. And the new lab in Rio keeps up with all that technology, and so they're able to bring right to the games the best testing there is today.
Well, Olympic swimming superstar Michael Phelps making headlines lately saying athletes who have previously failed drug tests shouldn't be allowed back into the sport. But how accurate are the tests? What are the chances that they got it wrong?
The tests are very accurate. They don't make mistakes. By the time they call a positive, there's a lot of work done to prove it beyond a shadow of the doubt. So there's no such thing as a false positive.
So do you think that athletes that have tested positively before should be allowed to compete?
If they have taken care of their penalty, which may be 2 years or 4 years, a positive test will usually give at least a 2-year penalty and oftentimes a 4-year. And those are significant amounts of time. Sometimes they get involved with lawyers and sue and try to get the penalty phase reduced. But in general, that doesn't happen. So if you're positive today, you're looking at a couple of years at least out of competition.
Well, doctor, the next frontier is gene doping, which is an offshoot of gene therapy where DNA is inserted to alter the genes to produce more hormones. How does that work exactly?
The labs have been working on gene therapy for 4 or 5 years. They're prepared for it. The mechanism of how they insert new genes or change the genes in the human body is very complicated. And if you change the genes and the person continues to live fine, that's okay. But you may find that when you start fiddling with the genes, they run out of control and they create really bad things. So it's not going to be easy for athletes to go to gene therapy or gene doping. But if they do, the laboratories will be ready for them.
They do seem to already be planning to test for that, so ahead of the game on that one. Thanks so much, Dr. Don Catlin, founder of the UCLA Olympic Analytical Laboratory.